one of the areas that I work on for couples and women, more specifically, is infertility. And it seemed apropos to do a show on infertility since we've been having a lot of success in that area. Particularly in the last month, we've had several pregnancies, and those pregnancies have been as a result of working on hormone balancing for the women primarily. Now, that's not always the case. Quite often, infertility can be related to the guy, which a lot of guys may have a little issue with understanding, or may tend to think that it's the woman all the time, but it's not. Sometimes the guy can have issues with, for example, sperm count, motility, morphology. These are some issues that relate to the guy. And then, of course, there may be other issues with relationship to performance. However, probably in the majority of cases, it is related to the woman's hormones. And sometimes it's a combination. It can be genetics as well. So we could have a combination where both partners have issues related to fertility. Sometimes it's the guy, sometimes it's the woman, sometimes it is related more to a genetic component. So these are the more common things going on. So what we have been focusing on primarily for the women that I'm talking about in the last month or so has primarily been the women's hormones themselves. And as I said, we've had lots of things going on, lots of ladies getting pregnant through via our help with hormones, hormone balancing, and preparing them for that. And that is a large part of this. Is when I'm working with women's hormones, I'm helping them create a better environment to allow them to become pregnant and hopefully to carry the pregnancy. In other words, to avoid issues with miscarriage or other issues that might come along. And it can be kind of a complex situation. However, I will say this: the average IVF approach, in vitro fertilization, runs somewhere in the U.S. in the range of $12,000 to $15,000 for one treatment or one attempt, and then there are all the other adjunct fees related to medical staff and other types of things that might be going on. So sometimes in the range of $15,000 to $20,000 per attempt with IVF. And I guarantee you that none of these women who have become pregnant through a path to wellness and through working with their hormones have spent anywhere near that. In fact, probably about a tenth as much, if that, and possibly not even that much, to help balance their hormones and make them more able to have a baby and carry a baby. So I think that's a huge success, and I have some background in infertility. Obviously, I've worked as a naturopath or a naturopathic consultant at an infertility clinic in the past, and I want to give them some credit for some of the background that I have. I was trained well by a lady who is well known in the infertility field, and I think she's due a lot of credit in that background as well. Obviously, I had studied before I got there, but then beyond that, what I've done is I have integrated into the protocols some additional forms of natural medicine that I have integrated into this whole protocol, and it's doing us quite well, as you can tell, having had several pregnancies inside of 1 month. We're doing great work here, and it's exciting because, you know, like I have a patient who has written a testimonial. You can see it on our website, which is www.aptw.net, short for A Path to Wellness. You can take a look at Andrea's story. She has written a testimonial for us on site. And in her case, she suffered from PCOS and had been told all her life that she would never have a baby from a very young age. And through doing the work that I do, and obviously her following the plan as I prescribed it for her, and you know, following through with some things, and also working on her husband a little bit, but primarily her hormone balancing and changing some things for her. It took us about 4 months of working on her hormones, and she got pregnant. Yes, there were some issues. It was somewhat of a difficult pregnancy, but we got her through that part too. And we went and celebrated her little girl's birthday about several months ago, when she turned 1. And it's just an awesome thing, you know, helping people bring life into the world, and to know that I've personally played a large role in that is just wonderful. It gives me a lot of satisfaction. And, you know, when I was working at the infertility clinic in Australia, I, at the time, didn't have any kids, and it was sort of a vicarious way to experience having kids by way of helping these couples through their infertility and changing that for them so that they can have kids and successfully having those kids. It's a wonderful thing too. So that's about a decade ago that I was doing that. So I've got, I guess, a fair amount of background and experience under my belt in helping couples have babies, have children. And there are a lot of issues that are not very well addressed through conventional approaches. Unfortunately, in the field or in the specialization of hormone balancing, there's not a lot of capability there, even with gynecologists or obstetricians. They just don't do that sort of thing partly because the focus is on symptomatic treatment and the use of drugs to treat all disorders. And in a lot of these disorders, that doesn't work very well. And particularly in the area of balancing of women's hormones. And what that means is it is a balance, essentially. That balance is a relative balance of the primary female hormones, specifically estrogen and progesterone. And there are over 25 different estrogens. It's not just one hormone. And balancing those hormones appropriately, combined with the level of progesterone, helps to attain these kinds of goals that I'm talking about. So, had a lot of success in that, but I would like to also talk about some of the things that can be problematic when it comes to having children. Okay, so I'll go into that sort of discussion about what to maybe avoid, what can be a problem for you if you're trying to have kids, what may be part of the issues, these kinds of things, to put it out there for folks to understand that there is help, there is hope. You know, I've been doing this a long time, helped lots, probably hundreds of couples have children that were having trouble doing that. And again, it's just a very satisfying experience when that happens. I get all excited because I know I'm playing a big role in that. And, you know, part of that process can be turning people's lives around in terms of their health and wellness as well. And so I'm taking part in that as well. So I'll go ahead and take a little break, and then we'll get into some areas that can be important when dealing with issues of fertility. If you're trying to have kids and having difficulty with that, that doesn't mean you have to go off and do IVF. Obviously, some of the fertility docs who specialize in IVF aren't going to want me to tell you that, but it's a fact. There are other ways. So we'll talk about some of that after the break. You're listening to A Path to Wellness on rhinoonair.com, WSPF Digital Broadcasting. And we'll talk some more about things to avoid and problematic areas and how you might address some of these issues after break. Good timing? Okay. So this month's article that I wrote is on schizophrenia. And then the next one will be on OCD.
Wow, schizophrenia.
Yeah, I just did a little brief article on it, but there it is, if you want to look at it when you're ready. So,
And where can people find that?
TampaBayWellness.com, the magazine, Tampa Bay Wellness Magazine.
Gotcha.
So this is my third in a series on natural treatment of psychological disorders.
Can you put that up to the camera? We're on a break here, however, great time to just do a little commercial.
Yeah, well, I don't know. Can we see that? Not here, right? So maybe.
What's the front of the magazine so I can know what to
Tampa Bay Wellness Magazine. Yeah, so this is Tampa Bay Wellness Magazine.
And then
So it's visible. Yeah.
Yes. And then
Yeah.
Cool. Like
So
you up
I
there.
think we might need like that right there.
Actually, we'll put it on the other one.
There you go.
Sensing.
Can you zoom in on it?
No, I can't
No?
think that. Let me see. I want to. I'm afraid to change it to
Have you been to Hooks in a while? Have you?
well, I went there like a month ago.
Uh-huh.
You like it?
I had lunch yesterday at Hooks and tried something that was really good. It was a, what do they call it? I think they call it screaming salmon or something. Yeah.
Sorry.
All right, so we are back and we are talking about infertility today. Yeah, and this is an issue obviously important to both men and women. So why men? Because men are a part of that equation for sure. The infertility is not always rooted in the woman's hormones. It can be rooted in the guy, and that means things like sperm count can be important to treatment, to changing those things, sperm count. There's also, I mentioned these terms earlier, motility and morphology. Motility is basically the ability to move forward quickly of the sperm, and then morphology has to do with the shape and can have a genetic component as well in terms of being shaped appropriately. So these kinds of issues can be related to nutrition. And one of the approaches to address those issues is to address them with nutrition. You know, if a guy's, typically eating McDonald's and having cheeseburgers, fries, and a Coke every day, the lack of nutritional content can directly affect his ability to produce good sperm, quality sperm. And this can affect fertility. So it's not just about the woman being able to use what she gets, it's about getting something good to use as well. So we want to address this kind of issue and have testing done quite often to avoid problems that can come along with having a poor quality of sperm to produce that child. So obviously genetically we want to avoid genetic disorders, right? We also want to make sure that the arrow can hit the target, so to speak. And this is where motility certainly can be involved. And then also the count, or the number available, the number produced, can be very important because, of course, your odds of getting to the target are higher if there are more arrows going toward that target, right? So I guess that's kind of the principle of machine guns in modern warfare, but not really the topic I want to get into. So quality and quantity and shape and size all relate to the ability to become pregnant. If a woman is inseminated with poor quality sperm, then chances of having problems during pregnancy are definitely increased. These can be genetic problems that result in miscarriage. These can be genetic problems that result in a baby who is not very healthy. So we want to work on this area to help the guy to make sure that what's being produced is going to result in a healthy baby, not just, get the woman pregnant. There's more to it than that, obviously. So we want to make sure of these things. Secondly, the area of the woman's hormones and the woman's ability to carry a baby, the woman's ability to respond appropriately to the hormonal changes that go on, and balancing those hormones to make sure that the environment is good for that insemination, and that, for example, if the environment is not appropriate, there may be killing off of the sperm that do get into the right environment or right area. So we want to create a decent environment for that to result positively. And that can be certainly related to balancing the hormones, the levels of estrogen and progesterone, to allow for appropriate insemination, including the longevity of the sperm, having it last in terms of not being damaged or destroyed by the environment inside the woman. So that is an aspect of it as well. Then we have the ability to provide nutrients to the baby, the developing zygote or fetus. And creating that kind of environment involves many things. For example, a woman may, during pregnancy, suffer from gestational diabetes. So this can be an issue related to blood sugar regulation. It can also be an issue related to thyroid function. Poor thyroid function can result in a child who has several types of learning disabilities. So a child born of a woman who has hypothyroid can be significantly affected as far as intelligence, abilities, brain levels of certain substances that help with the development of that child. Specifically, things like the cerebellum can be affected, the hindbrain. When that's affected, in other words, not able to develop appropriately because of a woman being hypothyroid, then this can result in further problems in the vestibular system, which is the area of the brain that is involved in proprioception, which means your ability to sense where you are in space physically. Also related to auditory and optical processing to appropriately adjust to different environments. And then also in the forms of learning disabilities such as dyslexia that can be problematic and as a result of hypothyroidism in the mother. So there's many areas that can be affected by that thyroid being out in the mother. And this is an important thing to check when becoming pregnant, is to make sure that that thyroid function is appropriate. Sometimes it goes the other way. Sometimes it's not hypo, but it's hyperthyroid. And then we have issues like tachycardia potentially, and even hyperemesis or vomiting, that may occur regularly. It may not just be morning sickness. It may appear as morning sickness initially, but it can actually be other issues. So there's the thyroid function. There is the potential for blood sugar regulation issues. There is also a potential for things like preeclampsia or hypertension, high blood pressure during pregnancy. That can be a problem as well. And one of the useful substances that can be helpful in preventing or minimizing the risk of a preeclampsia situation or hypertension during pregnancy is fish oil. Fish oil can be helpful because it helps to improve blood flow throughout the body. It also helps to change the situation when somebody has plaque in the vessels. It can help to dissolve or resolve that issue. And really helps in a lot of different areas. In fact, it can be important for not only the mother, but the child as well. Certainly, major components are DHA and EPA. DHA is very important to brain function, large component in the brain and the neurological or nervous system. So that can be very important to the health of the child, not just the mother. Avoiding situations like rickets, making sure your vitamin D level is appropriate. And that is a subject of great debate recently, because there are many in the field, including myself, who believe that we need to elevate the standards on our vitamin D levels. Vitamin D is such a crucial and important nutrient to us. We need to make sure that we find an optimal range, not just a minimal range or a basic acceptable range. We need to get into the optimal range with this kind of thing. So that's a part of having a woman be prepared to be pregnant, and also perhaps in some cases helping her to be more fertile. And vitamin D has a role as well in the balancing of hormones. Specifically, it's involved in thyroid function, calcium metabolism, in production of estrogen and progesterone, these kinds of things, and testosterone as well. It's involved in. So getting these nutrients balanced is important for both the man and the woman. And getting the couple on the right track can help to have that result of a pregnancy, and have it be a healthy pregnancy, one that is able to be carried to term. So that gives you a little more insight, and we will take another break because we love taking our breaks. And you're listening to A Path to Wellness on rhinoonair.com, WSPF Digital Broadcasting. And when we get back from break, we will explore further the topic of infertility and how to address these issues in a natural way through many areas, including hormone balancing and nutritional supplementation potentially. We'll see you after break. Did I call that one a little early? A little bit.
One of the things that, as long as you, even as the 15 minutes go by, if you just say you're listening to Dr. Wellness and WSPF-DB, Rhino, and this is Dr. Christopher Jackson talking about, and then you can keep on going from there. So you don't over the breaks. Since I'm doing another video with it as well, until we figure out a way to help the world. Because again, unfortunately for the editing, it doesn't let me, it cuts out everything from here on, for example. So if I go through YouTube to edit, so we're better off just keeping the flow available. So you can do the audio commercial break.
I'm missing something. So we want to do the breaks.
Talk, let's go.
Sure, okay, that's fine.
So what I'm saying is, that when you reach this, if you don't take a natural break on the 17 minutes, say, and you are listening to a part to our program that was recognizing on WSPF-DB, rhinoonair.com. We are talking about this on one.
Okay, let's do it after.
Keep on going, yeah, every 2 to 7.
I think that's great.
But it just helps because something wrong with what happened to you too. Comes on big time. But around and not season, all it does is it lets you cut. That's all, but it doesn't make you cut. Right? This little piece and everything really good on. Basically goes out here. It's everything from here on. Or everything from here on. So that's why I do the basic level at this point.
So let's do this. I'll take my magazine. Move it up. Over there.
Can you do that right now?
Is it on?
Yeah, the camera's on.
Yeah.
And
I
now
wonder if it's visible.
we're going on beyond 2 minutes, so we have to go back to break. So you may just want to sit down. It's visible.
Okay.
And remember, they're not paying.
Not paying.
You don't want that. But that's okay. I mean, it's there today, you know what I mean?
Well, it's showing me on the front cover.
Absolutely. They know how to find you. And you're listening to WSPF-DB right now. You're on YouTube right now and Google.
Okay.
Let's get back to
So my go ahead. Welcome back. You're listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com. And we have been talking about, I'm Dr. Christopher Jackson, and we've been talking about infertility and some of the approaches and areas that need to be addressed in terms of infertility for a couple. Now, the reason I'm phrasing it that way is because it's both the guy and the lady that we need to look at. It's not just the lady. And I know there's a lot of bias toward, oh, it's the women's hormones, but sometimes it's not. Or sometimes it's both. That is resulting in difficulties with pregnancies and or becoming pregnant. And this is a lot of what the term unexplained infertility comes from, right? Unexplained infertility is a conventional term, really, because conventional medicine doesn't address hormone balancing. So it's hard for them to explain why these things are happening, but the reality is that a lot of it has to do with the balance of hormones. And you know, I'm talking about a lot of different approaches. Some things I will mention specifically. Some things you just need to come see me about. That's really the best way. But if you're having these kinds of issues, but I'm not trying to diagnose, treat, or prevent any disorder. I am trying to give some information, having a discussion, even if it is unilateral at the moment, about infertility and different approaches to help this area and help couples to improve their likelihood of having children if that's what they're looking for. And so I mentioned before the break a couple of things. The areas addressing the male's issues, if there are any, and the areas addressing the female's issues, again, if there are any. It may be the guy. So back to the guys for a sec here. So if we get poor count, motility, or morphology, these issues can still be addressed. Basically, poor count is typically associated with testosterone levels. Poor motility can be related to poor nutrition. Okay, specifically antioxidants, somewhat specifically. And then there's morphology and there's motility. So both can be related to nutrition. So by taking a look at the specifics of those things, the issues can be addressed and counts can be improved, motility can be improved, and morphology can be improved. So in the approach that I take as a holistic physician in terms of the approach to fertility for a guy is more focused on nutrition, hormone balancing, just like with a woman, but a little different, to address the resultant, motility, morphology, and count. With a woman, I'm focused definitely on hormone balancing nutrition may be an issue as well, maybe an important issue. Certainly with an older woman who wants to become pregnant, such as someone in her 40s, say, it is a very important issue to make sure that nutrition is good, because that can affect the quality of the ovum. And you want to have an ovum that is good quality, certainly good DNA and so on. But the relationship to the quality of the ovum to nutrition is paramount. Now, in addition to that, we have the hormone balancing issue. If a woman becomes pregnant and it is too early in her cycle, what can happen is the ovum is not fully developed, and therefore it's not really ready to accept the sperm. And we may see problems either with the pregnancy, with the resultant child, or there may be miscarriage. If a woman becomes pregnant too late in her cycle, similar issues can result from that situation. So we have too late in the cycle. Again, we may have a poor quality ovum because it has been sitting around too long waiting, So at the end of the length of the ability of the ovum to really thrive, then we're going to have more issues with regard to, again, miscarriage, and the health of the ovum, and possibly relating to the health of the baby. So timing is very important in this. And this is part of what I do as well, is I look at hormone balancing, and I try to help the woman have more of an optimal overall cycle. A more optimal cycle means that the timing of ovulation, which is essentially the production of the ovum, or the release of the ovum is a better way to put it, from the follicle. The timing of that event needs to be such that the ovum has developed optimally and is ready to accept sperm and is healthy enough to accept sperm and produce a healthy baby. There are also issues that have been thrown at me in the past about, this old study back in, I believe, the 60s, late 60s, that said that women, and it's still conventional wisdom, that women are born with a certain number of eggs or a certain number of ova, and that's it. That's all you get, right? There are studies to refute that. In fact, Harvard has done several of them showing that it's very likely that the process is very similar to that of a guy, in that we are, with guys, there's a cyclical reproduction of the sperm from stem cells. And in women, according to these studies, the same situation is true, such that you can have nice healthy nice healthy ova in the 40s, regardless of this old wives' tale about women only being born with a certain number. So that's another aspect of this. If a woman is, borderline menopausal, then sometimes we can bring her back from that enough to have that child before she goes into menopause. And certainly the health of the ovum is important. And you see these studies that say, oh, past the age of 35, the chances of having a Mongoloid child would be like 1 in 12 or something like that. And really, that's statistics. So what is a statistic? Well, a statistic is, taking the whole pattern of normality over the whole range of women and how those results turn out statistically on average, this kind of thing. It's just a number, and it's really a number calculated from an average population without screening for things like, typically, like nutrition. In these studies that they do, they're not looking for people who are very, very healthy and very well prepared with appropriate nutrition and making sure they're not testing the health of the ova they produce or things like this. There's a lot of things missing in those studies where they come up with these statistics. So we can't just take the statistics at face value. We've got to understand the underlying factors. And some of those underlying factors are things like McDonald's, Burger King, and Wendy's. Okay? If they're eating garbage, what do you expect? What is expected of the result, right? The chances of having problems with pregnancy or problems with the child or the genetics or all of these different factors are increased when they're not properly prepared, just like the incidence of spina bifida when women are low in folic acid, right? So that's another area. That area of nutrition, making sure that there's appropriate levels of folic acid and B12 because they balance each other out. They kind of compete for absorption. That's an important factor as well. And then some others like B6, B3, niacin, thiamine, riboflavin, all of those, B1, B2, B3. They're very important in neurological function and the production of the nervous system. So, and then there's blood flow issues and so on. So all of these areas need to be addressed when dealing with infertility and dealing with couples that are having difficulty having children. So when I call my practice and when I talk about wellness, when I call my practice a path to wellness, this is what the philosophy is. Helping people be well, and by helping them be well, doing it in a balanced fashion to where things are working right. Hormones are at the right levels to prepare for the pregnancy. Nutrition levels are appropriate so that things are working correctly in the body. So this is how we prepare an individual for pregnancy. And this is for both men and women. So we look at wellness, we look at nutrition, we'll look at hormone balancing, get all of these situations in more optimal ranges, including thyroid function, hormone, female hormones, male hormones, the whole works. Get them all ready, and the more you do that, the more appropriately they're treated to help this situation, the more likely the pregnancy. And we've been proving that over and over again lately. So having good results and excited about all the pregnancies we're seeing in the last month or so. It's been quite exciting. So, this branches out into treating women's hormones in general, helping to balance those hormones, as well as with the guys. There can be issues like low testosterone, There may be issues of nutrition and its effect on quality of sperm and things like that. But also, you know, even later in life, hormonal issues are quite important, especially, of course, for women going into menopause, and then also men who may be having some functional issues later in life that may be related to having too much of the wrong kinds of hormones and not enough of the right kinds to make that a little better for them. So these are all sorts of issues that we address when talking about women and men, the health of women and men, and the wellness, and being able to have a healthy family and all of these kinds of things. So anyway, that's a wrap for fertility and hormone balancing in women and men and all those good things. This is how we approach these things. If you want more specifics, well, there's a couple of ways. One, I'm doing seminars in the area, and so you can look out for seminars. We'll post them as events on our website. You can take a look at articles that I'm writing in Tampa Bay Wellness Magazine and others that are linked onto my website, or the A Path to Wellness website, aptw.net. You can look for YouTubes where I talk about some of these issues. We've got lots of videos on the website, specifically YouTube videos. So there's a lot of resources that we're trying to provide for people to learn more, but certainly the most optimal approach, the best approach to address issues of these sorts and many others that deal with metabolism and so on, diabetes, hypertension and so on, is to come in and see me one-on-one in the practice at A Path to Wellness. And so if you want to do that, if you want to come in and talk about some issues like this, our number is 727-329-9637. We're in Northeast St. Petersburg, Florida, and love helping people with this kind of thing. So, or you can take another look at our website at www.aptw.net. Once again, you're listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com. And geez, I'm just going to be getting into all sorts of things in the future, so I'm not going to pin myself down for right now. But I think what you're seeing, if you're looking on YouTube right now, is an article I wrote recently, which is being published in the September issue of Tampa Bay Wellness Magazine. And it is on natural treatment of psychological disorders, and that's a series. And this current one, the issue, is on schizophrenia. So if you're interested in any of this stuff, all of this stuff, just take a look. We got lots of resources for you to check out. Thanks for listening.